I'll be discussing low back pain. This is by far the most commonly injured part of the body, and I will be discussing common causes of pain and dysfunction in this region that can affect one's quality of life. Low back pain remains to be the most common area of pain in our society today. An estimated 85% of the population will experience low back pain at some point during their lifetime. It is also one of the top 5 reasons for all doctor visits in the United States. Low back pain consists of problems in the lumbar spine, which is the lower region of the spine right above the pelvis. It is made up of 5 bones called vertebrae. So it's these 5 right here, 1, 2, 3, 4, 5. And low back pain refers to any pain and dysfunction in this region, with possible referral pain into the legs. Now there are 5 main causes of pain in the lumbar spine that I will be discussing in this Pain 101 course. The first thing I'm going to talk about are disc injuries. As shown here, a normal healthy disc provides cushion and separation between vertebrae and act as shock absorbers during the body's daily activities. However, discs can degenerate due to usual wear and tear, as shown in this part of the vertebra here. When this happens, the vertebrae become unstable and puts additional stress on surrounding tissues. Now, discs can also become injured and cause the material inside to bulge out or herniate, as shown in this model right here. Now, when this happens, the outer part of the disc actually tears and can cause a significant amount of pain. This commonly happens with bending and twisting or heavy lifting with poor mechanics. Now, here's an example of what it looks like to lift with poor mechanics. So as you can see here, she doesn't use her legs and she just has an excessive bending and twisting of her back, which can cause those disc injuries. Another common injury are pinched nerves or sciatica, which occur when there's excessive pressure on a nerve, leading to weakness, numbness, or pain radiating down the leg. Disc injuries are one of the most common causes of pinched nerves. As you can see in this model, if the space between each vertebrae are decreased, the nerve, as it exits, will become pinched. A disc bulge or herniation can also cause direct pressure on the nerve as it exits. Joint irritation is another common problem seen in the lower back. Joints in the spine are called facet joints, and they run along both sides of the spine, as you can see right here on both sides. If irritated, they can swell and become painful and limit movement. Joint irritation is often caused by inefficient postures, remaining in awkward positions for prolonged periods, or by quick sudden movements, including car accidents. So here are 2 examples of what I mean by awkward positions or inefficient postures. So in this position you can see here, she's standing pretty much with her back extended too much and it's causing a lot of compression in the low back. Another common one would be when people are just standing and they put a lot of weight on one leg, and that just causes a lot of shearing into the low back. A common problem that occurs as we age is arthritis. Arthritis is the wearing out or degeneration of the facet joints here, or the actual vertebrae themselves here. In this model, you can see a normal, healthy vertebrae right here versus this one that is wearing out and losing height. So arthritis is often caused by repetitive, inefficient movements over time or due to usual conditions of aging. The last thing I'll be talking about are muscle spasms and strains. These are irritation and injuries to the back muscles right here, causing them to involuntarily contract or become excessively tense and cause significant amount of pain. Spasms and strains commonly occur from trauma, overuse injuries, prolonged poor postures, and repetitive movements. It is also very common for the superficial back muscles to get tight due to weakness in some of the core muscles inside. If you are experiencing pain in your lower back, there's a lot you can do to decrease your pain. Initially, it is important when you're experiencing low back pain to limit your activity and rest so that your back can heal. This includes finding and staying in a position of comfort as much as you can for the first few days. Cold packs or ice should also be applied to the affected area 3 to 4 times a day for the first 2 to 3 days. This is a great modality to help decrease pain and inflammation. In addition, there are specific exercises you can perform to help decrease pain, promote healing, and improve mobility. On this site, we have provided you with several exercises that you can perform to help you with low back pain. If you continue to experience pain or problems in this area, then physical therapy may be your best option. Physical therapy has been shown in numerous studies to be a very safe and effective way to treat low back pain. Physical therapy consists of hands-on treatment to loosen up muscles and joints, education on efficient postures and movements, instruction on specific exercises, and modalities such as electrical stimulation and ice to help the affected area heal. If the information and exercises provided on this website are not helping and you continue to have pain, please call our office for a free consultation. I hope this video on low back pain has been helpful. I encourage you to check out our other videos on this site to help you live a healthier life.